Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rankus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you, everything from nutrition and mental health to alternative therapies and natural living.
We'll bring you the expert interviews, insightful discussions, and practical tips to make motherhood a little easier and help your family thrive.
Please keep in mind that this podcast is for informational and educational purposes only and is not intended to replace the advice, diagnosis, or treatment plans you have with your personal healthcare team. Please have a conversation with your trusted healthcare provider prior to making any changes or implementing any strategies or advice you learn from this podcast.
Whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Here at the Motherhood Alliance podcast, we challenge the status quo, ask the tough questions, and offer a supportive community for moms who want to make an informed, holistic choice.
Thank you for joining us on this journey.
Let's get started. Hi, we are Britt and Andrea from motherhoodalliance.com, and we're excited to welcome you to a 4-episode series with Dr. Veronica Tovar, a Greenville-based dentist who has taken whole body health to an entirely new level. Beyond traditional dental training, Dr. Tovar has trained with some of the top institutes in airway health, myofunctional therapy, oral restrictions, dental sleep medicine, sedation, laser dentistry, you name it, she's probably had some training in it. She's an ambassador with the Breathe Institute and a Breathe Baby affiliate. She's also a Vivos and tooth pillow provider. What really drives her, though, is the belief that the mouth is the gateway to the rest of the body, and the ripple effect she sees when patients finally feel better, breathe better, and realize they didn't have to live feeling the way that they did. As a mom herself, she is especially passionate about helping future generations grow and thrive optimally, and she loves supporting mothers through healthier breastfeeding and airway journeys. Outside of her practice, Veronica's all about family time. She enjoys golfing, working out, reading, and keeping her violin skills alive as well. She and her husband are raising 3 daughters who are currently 7, 9, and 11, along with their 2 pups, Rocky and Raina. All right, you guys, you are going to learn so much from Dr. Tovar. Let's jump in. Hey everyone, welcome to a brand new 4-part series. We are excited to welcome Dr. Veronica Tovar to the mic. Welcome.
Thank you very much.
We're going to be probably blowing your minds, to be totally honest, in these episodes, because we're going to be talking about dentistry, but probably in a whole new way that you may have never even heard about before. But before we start that, we want to learn a little bit about you personally. And so we're going to start with your fun fact. And you shared with us that one of your college jobs was stage setup, and you would climb rope ladders, you would run spotlights, all this stuff, and that you had a favorite performance as well. So why don't you tell us about your experience with that?
Oh, for sure. Probably one of my fun experiences in life was working for the Bradley Center. And I took on the job because it paid the most.
Oh, yeah.
And nobody wants to know what the minimum wage in those days was, but this was like twice the pay rate of minimum wage. But, I have to pay bills while I go to school at the same time. And working at the Bradley Center, I started out with doing setups. So we would do transitions from Bucks basketball to Admiral hockey, and I would actually work games for Admiral hockey where I would get on the ice if a glass broke and change it out because it got a good hockey puck hit. And it was fun. And as I continued working for the Bradley Center, I have some AV background. That was my junior high audio visual fun fact there too. But I used to run spotlights. And because I would do stage setups for the Bradley Center as well. So they would have Disney on Ice. They would have performances on ice. They would have concerts, Garth Brooks. And, of course, my favorite, as I told you, was Celine Dion. Mm-hmm. So that was the year the movie Titanic came out.
Oh, well, that was epic.
And for her performance, we usually go on the catwalk of the arena to run spotlights, even for game time.
Okay.
And this one specifically, her stage setup was a truss lighting above, and the crowd was on this ground stage, and we had to climb up the ladders up on the truss and then bring up my ladder and sit in my spotlight seat.
Wow.
Well, and I got to see her firsthand right above.
Right front, center,
and she did
on
the
top.
song, the infamous Titanic song,
Yeah.
My Heart Will Go On.
Yeah.
And her stage was set up like the shape of the heart. So at the tip of that stage was the peak or the point of the heart where the bow of the Titanic came up when she was performing that. And I was front and center with my spotlight.
That is super cool.
Yeah.
Wow.
It was fun. It was amazing. Saw a lot of amazing shows doing that gig. And not only did I work there, I worked at Alpine Valley and the Riverside Center and different because, your name goes around when you do a good job. And
Right.
they say, hey, you interested? Are you available? And you just pick up different gigs.
That's
I haven't
super
watched
cool.
the Titanic since probably, I don't know, high school, junior high.
Yeah, maybe.
You're inspired. I want to sing the song
know.
right now. Let's all bounce it out together. Just kidding. We won't do that. Well, that's an amazing fun fact and very unrelated to the field that you're in now. So you're now in dentistry and airway dentistry and even deeper than that. But how did you get interested in dentistry in general? And then how did you get introduced to airway? Did you learn about it in college or somewhere else?
So I'll say I got into dentistry first because I was hurt. Okay. Nobody wants to get hurt. And for me, it was one of those things that I had a small little cavity that was found. And they said, hey, you're here already. We can take care of this for you already while you're here, which, I'm very obedient child and you do as you're told. My parents, I was 17.
Okay.
My first cavity, don't tell anybody. My first cavity, cheek side, lower left side. And my parents were like, yeah, we're here already. Go and take care of it. And he says, it's very small. We'll be able to take care of this for you. No problem. Shouldn't need any anesthetic. Started drilling and it hurt. I said, ow. He's like, you're okay. You're fine. Does it again. Ow. He's like, you're okay. Almost got it. Almost done. I'm like, ow. He's like, we got it. It's fine. I'm like, I didn't care for it. I did not like not being listened to. So I said, well, this can't happen. I can't let this be. Besides that, I also did a clinical observation as part of a project over the summer, and I observed a dentist who worked there where I grew up in Kenosha and just showed me, alginate and taking impressions and being able to pour a stone model. And I had a replica of my own thumb, my own finger here. And I thought, this is amazing. This is impressive. So I applied. I got in. I did pretty well to get into dental school. And getting into airway, no, it's not taught in dental school, unfortunately. There's a lot to learn anatomically, structurally, dental anatomy, restorations, materials. So there's a lot just going into learning what we need to do for dentistry in general. Fast forward a few years after being in practice, I was an associate of 2 different practices and doing a lot in dentistry. I wanted to expand myself. I wasn't just about filling a tooth or crowning a tooth, and got into implant dentistry and then got into sedation dentistry because unfortunately, when you look at the physiology of somebody's apprehension, if you understand it, you can understand that unfortunately people can't overcome those things, those fears, those apprehensions. And as much as you tell them it's okay, they're not. So that's where I got into sedation dentistry, because if I can help someone get comfortable, get relaxed, then we can help them not feel any pain. Because the pain receptors already with their anxiety, when they're in a state of fight or flight, they want to run out of your chair. They don't want to sit there. They're like, I want to go. Heart races, they're blocking the same pain receptors we're trying to block with our anesthetic. So now they're like, you give them 4 or 5 carpules of anesthetic and that still hurts. So I got into sedation, then unfortunately seeing a lot of damaged mouths that, needed full mouth rehabilitation, and I wanted to do it right. So I got extensive training into full mouth rehabilitation, went through the Dawson Academy to learn about teeth and, centric occlusion and curves of spee, just a correct bite. But then understanding, well, there's more to the teeth than just how they relate in the mouth. There's muscles, there's ligaments, there's joint systems that need to take into consideration. And then one of the final years there, getting into the temporomandibular joint, then it was airway space. It was like, okay, we're doing everything here inside the mouth that has the corridors of our cheeks, and inside is the tongue, and what's in that vicinity is our airway space. And if we get damage to the teeth, why is that happening? And if we don't pay attention to the airway space, well, then everything we're doing in dentistry, fixing up our teeth, no matter how perfect inclines of occlusion or relationships or centric contacts. I mean, I can get into all of that stuff, but
no matter how nice the smiles are,
you can have a beautiful smile and have a suffering person in pain. And I see it a lot in my office.
So let's break that down a little bit, because when you're talking about airway, you think about air coming in and out, you're breathing. So you do that either through your nose, or a lot of people are doing that with their mouth open.
it's just something natural. It just doesn't seem to be something we think about, right?
So what do our teeth have to do with pulling air in and out of our body?
Well, it's not your teeth that's pulling the air in and out of your body, but it's the airway system. So there's 3 aspects of the airway, which is the nasopharynx, the oropharynx, and the laryngopharynx, okay? So a lot of what we learn as airway driven professionals, I will say, because there's a lot of us out there, is that physiologically speaking, at rest, all right, not fight or flight. We talk a lot about parasympathetic tone, vagal tone, being in parasympathetic state, is that I'm hoping as you are listening to me as well right now, is that your lips are sealed, tongue is up in the roof of the mouth, quietly breathing through your nose, all right? Where your teeth play a part is, are they squeezing together? Do you feel like your teeth need to meet for your tongue to be forward? Is there room for your tongue to be in the roof of your mouth? Or do you need to open your mouth to let your tongue out? Are we compensating? Are we bringing our head forward to help increase that airway space so we can keep the lip seal? Compensations are also muscle strains. We have a little mentalis strain or a strain in the chin to help us keep our lips closed. And if we don't do that from early on, because we know it's in our innate nature, we are born to be nasal breathers. That is why we can breastfeed, bottle feed. The only way my baby's breathing when they're breastfeeding is through their nose, right? So we know then we're healthier. So the teeth create the foundation, part of that foundation. It's not necessarily that's pulling air in or out, but it's creating a foundation for that air to go in somewhere.
So if somebody is listening to this, and as you were just saying that, they're like, oop, I'm mouth breathing. That's an indication, right, that maybe their airway health isn't ideal.
Correct.
What are some other common signs that someone might, or symptoms that someone might experience that might say, hey, this is something that you should have evaluated or just think about?
A lot of big things that happen is clenching and grinding. It's another big thing of compensation is daytime clenching, and then it's only get worse during sleep. If we are overall tired or unhealthy, high blood pressure could be from inability of breathing overnight. Any ailment can honestly come down to the root cause of mouth breathing or poor breathing or sleep disorder breathing. And working in your sleep doesn't allow you to get that quality of sleep to be as healthy as you can be. Optimal health is what we're looking for.
If someone is breathing well during the day, could they be not breathing well at night? Or is it kind of a direct correlation of if you've mastered daytime, then you wouldn't have a problem with nighttime?
If you're having troubles breathing through the day, yeah, there pretty much is a guarantee there's an issue problem breathing during your sleep. But there's a lot of people that can do things to get them to do what they need to do while they're awake, that they subconsciously can't do it while they're sleeping. When we fall asleep, we should be in a parasympathetic state of rest and digest. So we're not able to compensate or contract muscles, or at least we're not supposed to, because we're resting, digesting. We're allowing the brain to rejuvenate overnight. So we're not able to force muscles to do things that we can do during the day. So it is possible. And I can tell you, me personally, my own experience, having been through 7 sleep studies, and they've been through different systems that are offered for home sleep tests. And each of those sleep tests have come back that I'm fine. I have no problem. But what's fine and what's no problem? Because I could tell you before I started addressing my own sleep and breathing, I did not have as much energy as I have now.
Yeah, let's talk about your journey. Yeah, I'm curious now. You have my interest piqued. Why have you done 7 sleep studies? Is it because you're a professional and you're interested in this area and you want to test yourself? Or were you having signs and symptoms and now you've learned some areas that you've been able to improve in?
Personally, through training. So it's one of the things they offer as we're going through, whether it be the Breathe Institute or the Vivos Institute, is to understand breathing and the different home sleep tests, because I do offer home sleep tests in my office as well. And there's numerous of them out there, but which is actually giving you valid data, valid information. So part of the course, but also for me, it's one of those things that we don't think we have a problem. I will tell you, I certainly did not think I had a problem. I took my own records, had my staff take my records for me, and I compiled what we call an airway intelligence report in the office, where we look at my CT scans, we look at my pictures, we look at my photos. And I will tell you, my smile before, everybody could say, wow, you got a big smile. I mean, that was one of the things that my patients would come and see me, is like, I want my smile like yours. Well, I measured my width and I was still inadequate.
Really?
And my sleep, I couldn't tell you that I had poor sleep quality, because heck, I have 3 kids, and what we think is normal. I have 3 kids. I wake up because my kids wake me up. But I'll tell you, even while I was having my babies, I wasn't feeling tired. At least I didn't think so. So I go through these sleep tests, and it doesn't show up as having the AHI, the apnea hypopnea index. I probably had 1 or 2. So, that's what they call fine. But I'm like, I'm going to still try this, because I saw my records. I saw I have a little bit of a compensation, little forward head positioning. I did my transpalatal width measurements, and all of a sudden I'm like, oh gosh, I have problems myself. Not happy. I did this for my husband as well. And he's like, what, are you going to point everything that's wrong with me? I'm like, no, this is not the point of it. I just want to show you where we can make improvements. So I actually put myself through a Vivos appliance. I did not have sleep apnea, but I wore a sleep apnea appliance, because I know a lot of misconceptions and theories out there is that it's going to affect your bite and change your bite. Well, and it can if it's done incorrectly or not paid attention to, or we're not taking the appropriate steps and measures. So yes, you can mess up your bite. Put myself through a Vivos appliance, mmRNA, and I used that for 2 years. I gave myself 3 millimeters of expansion with that device alone. Okay. Can't really tell, got some spacing between some teeth, and now I'm in clear aligner treatment, and of course doing myofunctional therapy. So I've been through 3 different trainings for myofunctional therapy, so I've done a lot to train my muscles and be evaluated and assessed by different instructors and colleagues, etc. So yeah, fast forward to where I am right now, I do lip tape, I do my nasal hygiene, and I have expanded myself at least 4 millimeters.
Wow.
You can't really tell per se, but I can tell the difference. I have more energy. I can do more than I did before. Everybody has this, they talk about brain fog, and you don't think about brain fog as just like, where did that time go? I think my memory is sharper than it was before. So I didn't think I had a problem then, but I know I feel better now than I felt then.
Okay. And I'm guessing that's a lot of what you hear from your patients once they go through. Okay.
Yeah.
So I have so many questions. We're going to try and keep this episode focused, though, because you're touching on so many things that people are probably like, tell me more. What are you talking about? We touched on nose breathing. We're going to have an entire episode dedicated to nose breathing and why it's beneficial. And if you are currently a mouth breather, how to become a nose breather. We're also going to be talking more about the actual journey of what to do once you find out that you could use some airway help, especially if you have littles, identifying it early. But staying on this one, you were just talking about sleep. And so let's talk a little bit about sleep apnea, because I think that this is really prevalent in today's society. So if someone has sleep apnea, is this something that can be reversed?
Yes.
How? Give us a high level, because we're going to go in deeper into some of these topics in a little bit, but give us like a high level idea. And maybe a better way to frame this is, you are an airway dentist. So when you identify an issue with somebody, how do you approach them in your treatment to help them with things like sleep apnea? So how is your office different than a general dentist?
Well, first of all, the first question you had was with regards to how do you help somebody? And I will tell you the statistics, and this was basically done by a research scientist. He's a neurologist, sleep physician, and he's a specialist board certified in epilepsy. And he found that 98% of the problem for sleep apnea, which OSA is obstructive sleep apnea, is dental related, structurally, not enough room and space. The other 2% could be because of inflamed tonsils, inflamed adenoids, hypertrophy in the nasal passages, etc.
What about being overweight? Because you hear that too.
And obesity is a factor as well, but structurally, outside of adipose tissue, there is still the structure of the palate, the mandible, and where the teeth lay and where the tongue is. Now, I used to believe that there is no adipose tissue in the tongue, but there is. That's
So your tongue can actually grow or shrink in size depending on
there are
fat cells.
There are fat cells in the tongue. Now, not as much as we think because it's predominantly a muscle, but research has showed in the last, we'll say 2 to 3 years that I've heard this in one of my conferences or conventions, is that there is fat. But that isn't, that you have to think of the airway space three-dimensionally, the roof of the mouth, the soft palate, the base of the tongue, the room and space that the tongue has. How I approach my patients. I know I can be delicate for a lot of people. And I will, and especially patients that I've seen for many years. Okay, so it can be a touchy subject for some, but always with compassion and care and understanding that I do care.
Yeah.
And we want to help them be as best as they can be. Sharing my experience, sharing my husband's experience, and other patients' experience without disclosing names is the best way to say, hey, I know more now than I knew. Well, when I started practicing almost 25 years ago, and when I opened my practice almost 18 years ago, I know more now than I knew then. And I wish I knew all this then, but it really comes with compassion and understanding I can help you. I tell my patients I can't make them perfect, because otherwise I would work on myself, but that's not what we're looking for. We're looking for making you healthier, making you better. So we know, and we've seen it, and because I have stories to share that we've seen these improvements, these impacts where people are feeling better, and it's not all with the same treatments. It's customized. Everybody's different with what they can or cannot do or what they're willing to try. And I try to go from basic to what you can do for yourselves. I'll give them the resources. I'll point them to Buteco Breathing Clinic. There's an app. There's an app for us adults. There's an app for kids. And even those who are my athletes who feel, oh, no, I work out all the time, I'm good. Well, you have a problem, okay? Because obstructive sleep apnea doesn't just show up for someone who is, big and obese. A lot of our athletes are also restricted structurally. Those are your clenchers and your grinders who can maybe not have obstructive sleep. Before we get to obstructive sleep apnea, okay, that's end stage disease.
Yeah.
There is mouth breathing. There is snoring. There is upper airway resistance syndrome. And there's a whole list of other sleep disorder breathing issues.
Before you even get to that. Yeah.
Exactly.
Yeah.
And saying, can I reverse? Yes, we can. Can we make it better? Yes, we can. Yes, we can.
Where do you feel the future of dentistry is going? Is this something that's being talked about more now? Because as you're talking about this, I'm like, what an opportunity for dentists, because they're already looking in the mouth, they're already looking at the teeth and the structure, but maybe not in the lens that you're looking at it. Do you see this becoming more mainstream? How do you see the future of dentistry?
Oh, I certainly believe it. A lot of this is seen maybe in the East Coast, West Coast, a lot in the Denver, Colorado area, because, that's where a lot of my training took place as well. Word is getting around. This is not novel, okay? So with the research out there, and it comes down to the provider, the practitioner, okay? What do you want to do out of what you're doing? And for what I want to get out is I want healthier, happier patients. I want them to know that they don't need to, not just because their mom had a root canal or a crown or an implant or lost teeth, that the same should happen to them.
Mm-hmm.
We know more, so we should do more to provide better services for our patients.
I feel like everybody should at least have an evaluation done
by an airway dentist.
Well, we're going to continue this conversation in the next episode. Next coming up, we're going to be talking about starting early, and that might be looking at your kiddos and noticing if your kids are mouth breathing or if they're getting sick a lot or some other symptoms that may indicate that they could use some airway or some palate expansion. But also for adults, like there's so many of us that currently mouth breathe or are snoring or their spouse snores and you have to whack them every night because you're getting annoyed at their snoring. Hey, they might have a problem and we might be able to fix it. But starting as soon as you have new information is the ticket. The episode after that, we're going to be diving into that nose breathing, and this is going to be a really fascinating episode. And then we'll have another episode finishing up our 4th episode. You can stay tuned for all of these. They're going to be super excited. We're excited to continue the conversation. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.